Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Smileworks Orthodontics in Manassas, Virginia, discussing the latest advances in orthodontics and how they can help straighten your teeth and give you the smile you've always desired with one of this region's top orthodontists, Dr. Hussaini. Dr. Hussaini received his DDS degree from Virginia Commonwealth University School of Dentistry and his orthodontics degree from Columbia University. He is a member of the American Board of Orthodontics, among others. Welcome, Dr. Hussaini.
Thank you. It's nice to have you guys here.
Oh, it's our pleasure to have you on our program today. We've got a lot to talk about. We've got a couple of patients that are going to be joining us a bit later as well to tell us about their experience here at Smileworks. Okay. But I wanted to begin, if I may, Dr. Hussaini, by asking you if you can please tell us what are some of the latest advancements that have taken place recently in orthodontics.
Yeah, sure. There have been several major ones. I guess some of the big ones are Invisalign, which are basically, instead of the traditional braces, you can get clear aligners that sequentially move teeth. And then the other big one that's come along recently is what's called self-ligating braces, which are basically like a Damon system some people might have heard of. It's a type of the self-ligating system.
Oh, that's very interesting. And the Invisalign that you just mentioned a moment ago, I would take it that's sort of like the invisible braces.
Yeah, exactly. So you don't get the typical braces that are glued onto your teeth. Instead of that, it's clear trays essentially that you can take in and out, so that it's not as visible and it's basically hidden.
Well, I think that's a huge benefit for folks out there who need braces, obviously, to correct the problems that they have as far as straightening their teeth and so on and so forth. However, they don't want people to know they have braces.
Yeah, exactly.
And this, for the busy professionals, for teenagers and others who are conscious of that, that sounds like a perfect solution.
Yeah, it was actually designed initially for adults who are working and who just don't want to have the traditional metal braces. But recently, Invisalign has come out with what's called Invisalign Teen, which is designed for teenagers. And then they've made some modifications to help out with treating kids even who have some baby teeth still in the mouth, and made some advancements with that.
Very interesting. And can you please tell us a little bit more about the Damon system?
Sure. So basically, self-ligating system, which is the general category that the Damon system belongs in, it's basically it's a more efficient treatment mechanism where some of the friction and stuff that we experience, which is a limiting factor with orthodontics, is reduced. So your treatment is more efficient, and the frequency of visits, which is the biggest benefits, instead of coming almost every month, patients can come once in a month and a half to 2 months, so they get to save some of their precious time and still get the same results. So.
Very good. That's certainly a big benefit right there. Mm-hmm. Now, what types of problems do these treatment options correct?
So with Invisalign, it pretty much now they have made significant advancements even within the last 2 or 3 years, where when it was first released, it couldn't correct all the problems out there. And even now, there are some problems that it will not correct. But the beautiful thing about Invisalign is most patients can start with Invisalign. And if the problem is too severe, we can always, at the very end, go to traditional braces, but that way, it's a limited amount of time and we can still get the results. So pretty much you can treat anything you want. And with the self-ligating braces, with the Damon system, again, belongs to, it's the same thing as traditional braces. Anything that can be treated with traditional braces can be treated with that. So absolutely no restrictions.
Well, that's certainly very good to hear for all the folks out there that need or benefit from a treatment like this, or both these treatments for that matter. Yeah. Now, how different are these? I know you've touched on this a little bit already, but how different would you say these are, the Invisalign braces and the Damon system, compared to the traditional orthodontic treatments that have been available in the past?
Well, the greatest thing about Invisalign is it's clear. You can't tell. People can socialize. None of your colleagues or people you're associating with, they'll never even know in most cases that you have Invisalign. So that's the best thing about it. It's clear, as opposed to the traditional metal braces and wires and everything that goes on. With self-ligating, one of the biggest benefits is it's much easier to keep clean because you don't have the colors that are attached to the teeth, which tend to get a lot of plaque and stuff built up around them. So especially for kids, who have a hard time brushing to begin with, keeping the braces cleaner is a big advantage because we don't get issues with cavities and gum disease and things of that nature.
Very good, very interesting indeed. Certainly some clear advantages there and benefits. How long do these treatments typically take? And I preface that by certainly throwing in the disclaimer that I'm sure it varies based on the amount, the condition of each patient that this treatment is going to be performed on. But in general, what is somebody looking at?
On average, and a typical orthodontic case takes between 1.5 years to 2 years. That's the average time frame. As you were saying, some cases take a little bit lesser than that, some take a little bit more, but the average ballpark is 1.5 years to 2 years.
Okay, that's certainly good to know. And what type of results can we expect from both the Invisalign and the Damon system?
All right, so traditional metal braces would always give you great results, and with these systems, the beautiful thing is you get the same amazing results. You have a healthy bite at the very end, and you also have a beautiful smile that you can be proud of. So there's absolutely no difference in terms of the results that can be expected. It's amazing.
That's certainly good to know, Doctor. We're now going to meet Jordan and Cicely, who are two patients of Smileworks and Dr. Hussaini. Welcome, Jordan. It's a pleasure to have you on.
Thank you.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I wanted to begin, Jordan, by asking you if you can please tell us what brought you to Smileworks.
Well, my lower jaw is out of place, and my front teeth were all messed up.
Oh boy, sounds like you had a couple of problems there.
Yeah.
So what happened then? You came here to Dr. Hussaini, and what did you have done to correct those problems?
They tightened up my top braces. They've been working on them. They've been using a tighter chain, and soon I'm going to be using the rubber bands to make my lower jaw come forward.
Very good. So is this over a couple of visits, or?
Yeah, it should be 18 months when this is all done.
From start to finish.
Right.
And then those problems are totally gone, and you're a very happy Jordan, right?
Yeah. Straight teeth and everything.
That's right. So how do you feel about the results then, so far?
They've been great. My front teeth are straight now, but my only problem is my lower jaw. I just need to get my rubber bands in, which will take a couple more months.
Okay. All right. And lastly, before we let you go, Jordan, for all the viewers out there that are watching, what would you tell them about Dr. Hussaini and Smileworks?
It's a great experience. I've had a fun time with the point system they have and all the little things they have, like the video games in front. It's just a great experience.
It's really cool, isn't it?
Yeah, it really
It's a lot different than it used to be. Believe me, many years ago at most orthodontic and dental offices, things have really changed, and Dr. Hussaini certainly and his staff here have taken very good care of their patients.
Right.
Thanks again for joining us and being a guest.
Thank you.
Welcome, Cicely. It's a pleasure to have you on as well.
Thank you. Nice meeting you.
Oh, nice meeting you. And I wanted to begin, just like I did with Jordan a few minutes ago, by asking you if you can please tell us what brought you to Smileworks.
Okay, I have crowding in my teeth, which pushed the teeth out. Some of the teeth are sticking out. So whenever I smile, I always notice them. And so sometimes it felt like they were sticking out a lot.
Oh, so you were conscious of it, and this is something obviously that took place over several years where the crowding just forced other teeth out.
Yes.
And you were, like I mentioned, you were very conscious of it, so then you came here to Dr. Hussaini, and what did you have done?
We discussed the types of braces they have available, and we talked about how long it would take for them to straighten them out. And I chose the ceramic ones.
Oh,
I did.
Very nice. So these are the ceramic braces. And can you tell us about what the process was of having that done?
It was very easy. When I came in to have them put on, had no idea they were putting them on. You know, it was like a normal dentist visit.
Oh, wow.
And when it was over, I couldn't believe they were on already.
So it all took place in one visit when you came
one
here?
One visit, yes.
That's wonderful. And how long have you had them on now?
For a month.
Good for you.
Yes.
And what's the projected time period
2
for
years.
them to correct the problem?
It'll take about 2 years.
Oh, wonderful. So for the folks out there that are watching, what would you tell them about your experience here at Smileworks?
Oh, it's been great. This is a very friendly office. I feel like I'm coming over to visit my friends. Very techy office.
Yes,
which
very
is
high-tech
very
office.
cool, yes.
It is.
And it's the best decision I've ever made. I can't wait to see my new smile.
Oh, we're so happy to hear that. On that note, I'd like to thank you, Cicely, for joining us as well and being a guest in our program.
Thank you.
We're now back with the doctor. I must say they were both very pleased with the results thus far, and certainly their experience here with you at Smileworks.
It's great to hear that, and they're amazing patients, and I love working with them. So.
And I wanted to ask you, Dr. Hussaini, as far as follow-up visits for patients who, once the Invisalign has been put in or the Damon system, what would someone typically look at over that year and a half or two that it takes on average for each of those systems to get the results?
Typically, we see patients every 6 to 8 weeks. That's the typical duration. Every once in a while, we might have to bring them in every 4 weeks, but the usual duration is 6 to 8 week visits.
And who would be a typical candidate for either of these treatments?
Oh, anybody. We start, the AAO, American Association of Orthodontists, recommends a first child's visit at age 7. So we don't usually start treatment at that age, but that's a good time to just get checked up for the first visit.
Yes.
And then from that to, we've had patients in their 80s come and see us, so anybody pretty much.
Basically from kids right on up to anyone and everyone.
Yep.
Wonderful, who obviously has those problems.
Exactly.
Like crooked teeth, crowding, things along those lines that they normally would get braces to correct.
Exactly. Yep.
Are the results permanent from these systems once the treatment has been completed?
Yes, the results are definitely permanent. Now, every orthodontic case, you have a phase what's called retention, in which you basically get retainers. So as long as the directions are followed properly with the retainers, the results will definitely be permanent and guaranteed. So.
Certainly great to hear. Now, we're literally out of time, Dr. Hussaini, but I wanted to ask you before I let you go, you and your practice, Smileworks here in Manassas, Virginia, certainly have established a reputation for being on the cutting edge in high technology. I mean, it's literally like a futuristic office here. It's so gorgeous that you have out here, and you certainly have a great reputation for being one of the top orthodontists in this entire region. I wanted to ask you, what would you say helps separate you and your practice apart from many of the other orthodontists out here?
All right, so being a digital practice, we take what's called digital x-rays, which are much safer for the patients because they expose them to lesser radiation than traditional x-rays. And we also have what's called an on-deck system. Basically, when a patient comes in, they sign in the front desk. It's a touchscreen monitor. Kids love that, by the way. And as soon as they do that, their names show up in the back where we're seeing patients. So that way we make sure the patients aren't waiting too long and we can get them in and out of the office as soon as possible.
Well, it's certainly very good to hear. You certainly have quite a few major benefits that you offer here, and as the patients that we just interviewed a few minutes ago told us, you treat them like family here. You really care about them, and not to mention the fact that it's like, as I touched on as well a few minutes ago, it's like a futuristic office. It's amazing. It's just beautiful. It's something out of like Smarter Image, you know, as far as for dentists or orthodontists goes. It's really gorgeous, and the fact that you can be back here performing a treatment or working on a patient, but yet another patient can come in the front, and the minute they check in, you can literally see them up there on the terminals, which you have, these TVs all around your practice. It's literally like being at the airport and seeing when your flight's taking off or arriving, a version of that.
Yeah, it's important for me to take care of the patients. I mean, I want to make sure, I understand everybody is busy, so I just want to make sure, they get the best care possible, but also in the shortest time possible for them. So.
Yes, indeed. And on that note, I'd like to thank you, Dr. Hussaini, for joining us, being a guest in our program. It was a pleasure having you on, and certainly would love to have you back on in the future.
Definitely, and I thank you so much for having me, and I really appreciate you guys coming out here.